and welcome to Ticking to Myself, my video diary leading up to my open heart surgery. Today I had my pre-operative assessment day at the Leeds General Infirmary. I've not had one before, strangely, because the last time I had it, it was a bit of an emergency, so they didn't have the time to go through all that procedure. But this time it's a managed process. It's taken 2 years and 8 months to get to this stage. When I had the first surgery, and then they discovered, as I explained in the first bit, that they said I wasn't fit to go through the surgery again to fix the problem with the valve. They said it would take about 12 months before I was well enough to be able to have the surgery again. Well, as it's turned out, I've lived with this severe aortic regurgitated valve for 2 years and 8 months. It was decided a few months ago that I should go back through the process of leading up to this time a good, well managed heart surgery. So that's what we've done. So today was my assessment day. I got lots of stuff today. I got lots of goodies. I got a nice goodie bag. It's probably not as good as the goodie bag that was given out at the Mobos in Leeds last night, but for me it's a good day because it means things are moving forward, and with some apprehension I'm going into this. I wouldn't say excitedly, certainly nervously. There's a lot of anxiety involved. I'm fit and I'm well up to a point, as well as you can be with a severe aortic leak. So I was there for about 3 hours today, and I got all manner of booklets, keeping yourself safe during your stay in hospital, and in amongst that, and literally, there's lots and lots of booklets. So there's plenty of reading for me to do before I go in. I've got my dates for my surgery now. As some of you know, I've been waiting to have some dental work done that my surgeon wanted to be completed before I went in for surgery. The reason being is that my dentist decided that they didn't want to treat me anymore because I was too much of a risk for their practice. They won't treat anybody who's on warfarin, which I am. They won't treat anybody who's had any problems with heart valves, which I have. And some of the medications and one, they're just not happy with dealing with it. So I got referred to the Leeds Dental Institute, which was quite good because it's next door to the LGI, and they could liaise with each other to figure out timescales and when things needed doing. It wasn't done as quick as it should have been done, but it has been dealt with now, so that's why I can stand here and give you a big beaming smile. So maybe it's more of a cheesy grin. I don't know, you can decide. So I've got all my booklets. One booklet they do give you is this Your Heart, Your Recovery. I actually got this last time I was in LGI. If I'm honest, it's a good read. I'd urge anyone that gets anything like this to take it home, have a good read of it. It'll give you a lot of answers. My only quibble with this is that it's primarily designed for information with coronary heart disease, which I don't have. But a lot of the answers that they give to the questions that have been asked are the same across the board, whether you've had coronary heart disease or the whole range of problems. I don't know all the problems you can have with your heart, but as we all know, there are lots of them. We've all got different things that we are having to deal with, and in particular heart failure, which I suffered as a result of my valves collapsing. So a lot of the answers to the questions you'll be asking are in this booklet, even though it is aimed at a particular specific group of people. I know a lot of people think they're boring, but take the time to read it if you get one before you go into your operation. I found it useful last time. I'll read it again because there's no reason why not to. There might be some technology updates all the time, practices change all the time, so there might be things in there that you just didn't think about and that have changed. In my goodie bag I also got my antiseptic body wash stuff and my instructions and all that, to keep myself clean before I go in. I also was given the Neseptin nasal cream to put up my nose. I've used this before. I don't particularly like using it. I will, but it doesn't mean to say that I like it. It just feels a bit odd. The texture of it when you coat it on your nasal tissue. I don't like how that feels. But I've got to use that from this Sunday. For well over a week before I go in. So, and of course the other thing that I got is my orange liquid, the Hydrex surgical scrub for getting into all those nooks and crannies and make sure that you don't go in there with any bugs on your skin. So that I've got to start using that next Saturday, the 14th of November. So all that leads up to the fact that my surgery has been scheduled for a week on Wednesday. So what happens for me now is I'll be admitted to hospital to the LGI on the Tuesday the 17th and admitted then, and then I have my operation the day after on the 18th of November. I've been told that I'll be in for at least a week, and there is no end time that they will try and get me out. I've been told that because of my history and how poorly I was last time, they will keep me in for as long as is needed to make sure that I'm fit and well before they release me back into the big wide world. So that's where I'm up to. Pre-assessment done, and I've got just over a week to go now. As I say, a week on Tuesday I go in on the 17th. So I'll keep you updated as much as I can. I hope you find this useful. I'll hopefully see you on the next update. Bye for now.